As our board chair, Joe Kraus, just mentioned, last September marked Rutland Regional Medical Center's 125th year of service to Vermonters. This milestone did not receive the usual fanfare, as our hospital was focused not on celebrations, but on preparing for another wave of attack from the COVID-19 virus. And, as we now all know, last fall and winter was the most challenging period for us in the entire pandemic. We did not think we would be in this position, as we had just finished providing over 60,000 vaccination shots to our community. Our staff were fatigued and battle-weary from the toll of the prior 18 months. Yet they knew, ultimately, if they did not continue, there would be no one else who had the ability to care for those suffering from COVID, as well as other severe illnesses and injuries. And I am tremendously proud to announce that we succeeded in our efforts. Against overwhelming challenges, we successfully treated hundreds of patients suffering from the effects of COVID. Working together, we ensured that critical healthcare services were available throughout this period, and that we did not have to close beds or discontinue essential services like other hospitals throughout the country were forced to do. We established critically needed COVID testing centers and vaccination programs. And we partnered closely with the Vermont Department of Health, the Vermont Agency of Human Services, and the Vermont Emergency Management Agency to coordinate care and treatment throughout this period. We are fortunate to have had the steady and principled leadership of Governor Phil Scott and his administration. Governor Scott's guidance in responding to this crisis made Vermont the most successful and admired state in the nation in our approach to protecting our communities. But despite this success, this has come at a cost. Our staff have been through 2 years of protracted trauma and have been operating in continual crisis response mode. All of us throughout our country, state, and community have been through a period of extreme stress, where we were concerned about the health of our parents and our vulnerable friends and neighbors who had underlying health problems. We have been concerned about the impact on our school-aged children. We have been isolated from our loved ones and have not been able to have been with them in the hospital or to attend important events in person, like graduations and weddings. We have all suffered throughout this pandemic, the most devastating public health crisis in our lifetimes. But unlike other workers, those on the front lines of healthcare haven't just carried their own burdens. They have also taken on the fears, anxieties, and suffering of those in their care. In response, throughout the country, many healthcare professionals simply threw in the towel. In fact, The Atlantic magazine estimates that the United States has lost as much as 20% of its healthcare workforce over the past 2 years. At Rutland Regional, workforce recruitment and retention is our top priority as we work to recover from the pandemic. Today, the pandemic itself has largely slipped out of the public eye, upstaged by politics, foreign affairs, and the dramatic resurgence of inflation. Still, the COVID-19 death toll in the United States will soon surpass 1 million lives, with over 80 million Americans infected. And despite the fact that we are done with COVID, it remains to be seen if COVID is done with us. As we in healthcare turn our attention to the future, we see more uncertainty than ever. What will COVID look like going forward? How successful will we be in our plans to rebuild our workforce? What will the demand be for the dozens of essential healthcare services we provide our community? Will the spirit of partnership with our payers and regulators continue? Will Vermont maintain its position as one of the healthiest states in the nation with one of the most progressive and lowest cost healthcare systems? I don't know the answer to these critical questions, but I do know that the solutions will come from the same resolve and cooperation we all demonstrated throughout the pandemic. Rutland Regional stands ready and willing to do our part. I remain inspired by the grit and selflessness of our employees. As we move forward from the crisis stage of the pandemic, they continue to show up to do what is needed to be done. As we move forward to brighter days and new challenges, we want to shed light on some of the people who were there for our patients at their time of need. This year's annual report attempts to tell some of the unseen, unheard stories of Rutland Regional's employees. We've created a video series called 19 Stories to document the pandemic here at our hospital. This project consists of interviews with our staff, both those who are on the front lines of care and those who work behind the scenes, keeping our hospital functioning. Some of these stories are joyful, reflecting on friendships and possibilities created in the cauldron of the pandemic. Others are as raw and painful as the pandemic itself. Tonight, I want to share part of this project with you all. It's a short video we are calling The Letter. I hope you appreciate it and the people in it as much as I do. But first, please join me in a round of applause to recognize the Rutland Regional employees and all those who supported our mission to protect our patients, protect our staff, and ensure the operational capability of Rutland Regional Medical Center throughout the pandemic.
If I were to write myself a letter and have it delivered back to who I was in February of 2020, I think that I would say, you know, this is gonna be really hard, but you're gonna do your best. I'm gonna cry again. And when it's over, you're gonna be so proud of yourself.
What would I write back to in 2020?
That's a good question. I guess, you know, not to use a cheesy metaphor, but it's a marathon, not a sprint.
I would say good luck and face every challenge with your best effort.
You're gonna make it through it. You're gonna survive. You're gonna be stronger than you think you were, because it's gonna change your perspective on a whole lot of things.
You are gonna be tested, and you are gonna be challenged, and you are gonna laugh, and you're gonna cry, and you're gonna make amazing friends, and you're going to do things professionally that you didn't see coming in your future.
Take a breath. Things are gonna get really, really crazy, but you have this. You got this. You're gonna be okay.
In the early days when we had no protection and there was a lot of fear and concerns, we still did what we needed to do to take care of the patients, and most of those patients survived. And they wouldn't have survived if we didn't have good people at the bedside 24/7.
We'll have very difficult days, but we'll all get through it. And we'll get through it because of the support of the hospital and our colleagues and the community.
I think the advice that I would give myself is to know that it was going to be a marathon and we were going to have to dig in for a long time.
It's going to be tough. It's not going to be easy, but you can do it. You will do it. And you will have your team behind you to get you through it. Stay strong. Do your job. Be there for your patient.
Do everything you can to make sure everyone knows their value and how they can feel fulfilled in what they do.
Have faith. Have faith that everything was going to work out, because there was going to be some really hard times.
It's stressful, but we all just kind of work as a team together, and it's really wonderful.
It's important to take time for yourself and to make sure you check in on the people that seem like they're okay, because anyone can smile, but it doesn't mean they're actually okay on the inside.
Take it day by day. Like, do the best you can.
It's okay to struggle. It's okay to not have all the answers.
Buckle up. It's gonna be a long ride.
This is not a test. This is all real.
Don't put off till tomorrow what you can do today in your personal life.
Get that last hug in before everything shuts down.
Take it seriously. Be prepared for what's coming. Brace yourself emotionally, because it's gonna be a long road.
When we're overwhelmed, just take that time. Find something you enjoy. Go for a walk.
Just breathe and let it out.
We can get through this, and we're strong. You know, we can fight this. Look at where we are today.